here is ready to start a family? Or who here does want to start a family but not at this very moment? Well, that's why people should consider birth control if you're not ready to start a family. Birth control is available and there are different types of birth control to meet your needs. After having one child, me and my husband decided that we don't want to have another child anytime soon. So I researched for 3 months to decide if I want to take birth control or what kind of birth control is right for me if I wanted to take birth control. I will start by talking about what is birth control and what are the different types of birth control. Then we will look out on how to choose the right birth control method for you. Now that we considered how many people want to know about birth control, we will talk about what is birth control. Birth control is any pregnancy prevention method. Methods include medications, procedures, devices, and behaviors. There are many types of birth control methods, including IUDs, birth control pills, rhythm methods, and procedures, of course. Several methods are widely available at drugstores, such as condoms. Some methods do require seeing a doctor, such as prescription pills. As Dr. Glupa states, it is a method of contraceptive that prevents a woman from getting pregnant. But how each method works, as well as side effects, pros and cons for each differ. After you decide if you want to use birth control, you can start by learning the different types of birth control available. What are the different types of birth control available? There are different types of birth control. Hormonal patches, which include pills for birth control, shots, skin patch, and vagina ring. Birth control using hormones is very effective against pregnancy. In addition, implants and hormonal IUDs are hormones to prevent pregnancy. There are also implants, devices, IUDs, that provide long-acting reversible contraception to not get pregnant. Long-acting means taking years to prevent pregnancy. Reversible means that if you want to get pregnant later, you can, but you have to get them removed. There are also barrier methods that include condoms, diaphragms, and sponges. These don't necessarily prevent pregnancy as do IUDs or hormonal approaches. And barrier strategies should be used whenever you're having intercourse. Depending on your health, certain forms of birth control may or may not be safe for you. You must figure out which birth control method is the best for you. As Dr. Gosh states, finding the right birth control is such an individual experience. It comes down to trial and error. What one woman responds well to may not be the right fit for another one. How do you choose the best method? Well, first of all, how does birth control work? How does it work? Think about how important it is to you to avoid pregnancy. Then look at how each method works. For example, if you plan to have a child soon, you may not need a very reliable method. Also, when choosing a birth control, you have to think about how much effort it takes. Birth control pills, for example, may not be a good choice if you often forget about medication because you need to take the birth control pills at the same time and at the same day, every day. So if you're not sure you're going to stop using a barrier method anytime soon, you're having sex, then choose another approach. When do you want to have children? Also, you have to think about how soon do you want to have children. For instance, birth control shots might not be a good choice if you want to have kids in the next year or so. They will make it difficult to become pregnant several months after you stop them. If you want to have babies, it's not a good choice for natural family planning because it often fails. I hope I've told you enough about preparing for your future, and when you are ready, you can make your dream of having children, if you want to, or if you don't, come true.